In the heart of Toronto, Canada, Hope for Refugees International convened the first edition of the Global Conference on Sexual Health, Reproductive Rights, and Gender Equity in Refugee and Humanitarian Crises from May 7th to 8th, 2024. Under the theme Rights, Dignity, and Access, Advancing Sexual Health, Reproductive Rights amidst Refugee and Humanitarian Crises, the conference gathered stakeholders to address and propose solutions for sexual reproductive health and rights, SRHR, and gender equity challenges in refugee settings. Key objectives for the conference: 1. Knowledge exchange and best practices. Experts shared innovative strategies and successful initiatives for delivering SRHR services in crisis contexts. 2. Policy advocacy and recommendations. The conference convened workshops and sessions focused on delivering and developing actionable policy recommendations to protect SRHR rights and promote gender equity. 3. Empowering local communities. Capacity building workshops aimed at equipping community representatives and refugees with knowledge and skills to promote sexual reproductive health and gender rights were convened. Strategic partnerships and funding. The conference featured discussions on promoting collaboration among stakeholders and strengthening funding for SRHR initiatives in refugee communities. And 5. Fostering inclusive dialogue and learning. The conference provided safe spaces for refugees and humanitarian workers to share experiences, enhancing mutual learning and empathy. Key highlights of the conference. From the keynote address, Bansel Nidi from Care Canada emphasized the critical urgency of addressing sexual and reproductive health and rights, SRHR, and gender equity in refugee responses. She highlighted the significant scale and severity of these challenges, noting that approximately 4.3 million sexually active individuals worldwide receive inadequate access to sexual reproductive health services. She cited the World Health Organization estimates indicating that as of June 2020, 200 million women and girls globally have experienced or had experienced female genital cutting, with its severe physical and psychological impacts. Furthermore, around 33,000 child marriages occur daily, 25 million unsafe abortions happen annually, and numerous other SRHR issues remain unresolved. Needy stressed that these issues are even more pronounced among women and girls in refugee and humanitarian settings, where gender-based violence, unsafe abortions, and poor obstetric care are leading causes of female morbidity and mortality. According to a 2018 United Nations Population Fund report, over 500 million girls die daily from pregnancy and childbirth-related complications in these settings. She emphasized that women and girls in this context are continuously deprived of essential sexual reproductive health services, leading to devastating consequences. Panel discussions. Experts like Lisa Duplessis from the 519 in Toronto and Sarah Flanagan from Community Health Caring in Kitchener discussed challenges and solutions for sexual reproductive health and rights in refugee settings. Mariam Pandey from Choice in Health Clinic Toronto and Kendra Wahim from Community Health Care in Kitchener focused on strategies for improving access and quality of essential SRHR services like abortion care, contraception, and STI treatment. Empowering refugees and enhancing sexual reproductive health knowledge and access. Led by a team from Toronto Public Health, this session equipped Black African refugees, newcomers, and LGBTQ+ individuals with essential knowledge and resources regarding their sexual reproductive health, covering topics such as reproductive health, rights, contraceptive options, family planning, maternal and child health care, STI prevention, and access to healthcare services. On day 2, sessions like tackling HIV/AIDS and stigma were held, and Ian McKnight from the Toronto People Living with AIDS Foundation, and Emmanuel Njenabo Lambert from Africa in Partnership Against AIDS highlighted the challenges faced by Black and LGBTQ refugees in accessing HIV/AIDS care and support services. Shemaine Mohammed Jr. from Let's Stop AIDS and Anna Simbwa, a trans rights activist, discussed strategies to promote equity in healthcare delivery for refugees living with HIV and AIDS. Integrating SGBV and SRHR services. Blessing Diga from End FGM Network Canada, Pauline Wangari from Kenya Women in Canada Association, and Tashin Rodoshi from Awura Freedom International discussed survivor-centered approaches and policy frameworks. They explored the intersection of sexual and gender-based violence, SGBV, prevention efforts with SRHR services, addressing barriers to SRHR service access and the underlying factors perpetuating these challenges. Youth voices in SRHR advocacy. Youth activists Simona William and Andrew Townsend from Action Canada for Sexual Health and Rights emphasized inclusive and culturally sensitive SRHR education for refugee youths. Ray Jaden from SRHR Hub discussed obstacles hindering young people's access to comprehensive SRHR information and services, exploring factors such as cultural norms, socioeconomic disparities, and legal barriers. Key recommendations from the conference. Recommendations for service providers. 1. Implement culturally sensitive training programs for healthcare providers to ensure respectful, non-discriminatory care for refugees. 2. Establish mobile clinics and community-based healthcare programs to enhance access to SRHR services in refugee communities. 3. Integrate SRHR education into existing support systems with a focus on addressing culture norms and language barriers. 4. Foster partnerships with community organizations to expand outreach and service delivery for vulnerable refugee populations. 5. Prioritize trauma-informed and gender-inclusive approaches for sexual reproductive health service provision to promote dignity and respect for refugees. 6. Develop targeted interventions to address HIV/AIDS stigma and discrimination within refugee communities, including culturally sensitive education and outreach programs. 7. Implement comprehensive sexual and gender-based violence prevention strategies within sexual reproductive health service delivery, including trauma-informed care and survivor-centered approaches. 8. Expand access to youth-friendly sexual reproductive health services through community-based initiatives and peer support networks. 9. Strengthen partnerships with refugee-led and youth-led organizations to enhance the engagement and participation of refugee youths in sexual reproductive health programming. And 10. Provide training for healthcare providers on the intersectionality of sexual gender-based violence and sexual reproductive health to improve service delivery for vulnerable populations. Recommendations for policymakers. 1. Allocate funding and resources to support community-based initiatives aimed at improving access to sexual reproductive health services for refugees. 2. Develop and address policy frameworks that address systemic barriers, including legal status and discrimination, hindering refugees' access to SRHR services. 3. Establish guidelines for culturally appropriate sexual reproductive health education and service provision within refugee and humanitarian settings. 4. Strengthen collaboration between governments, refugee-serving organizations, and stakeholders to ensure coordinated efforts in addressing sexual reproductive health needs. 5. Advocate for inclusive policies that protect and promote sexual reproductive health rights of refugees, particularly women, girls, and LGBTQ+ individuals. 6. Advocate for policies that prioritize equity in healthcare delivery for Black and LGBTQ+ refugees living with HIV and AIDS, including increased funding for community-based HIV programming. 7. Support initiatives that address systemic barriers to accessing sexual reproductive health services for refugee women, girls, and LGBTQ individuals, including legal reforms and anti-discrimination measures. 8. Incorporate sexual and gender-based violence prevention efforts into refugee health policies and guidelines with a focus on survivor support and community engagement. 9. Promote youth-friendly policies and programs that empower refugee youth to access sexual and gender-based violence services and participate in decision-making processes. 10. Invest in research and data collection to inform evidence-based policies and interventions aimed at improving sexual reproductive health outcomes for refugee populations. In conclusion, the conference provided a platform for dialogue, collaboration, and advocacy to tackle the complex SRHR and gender equity challenges faced by refugees. Participants committed to translating insights and commitments into tangible actions and policies, prioritizing SRHR and gender equity in humanitarian responses to improve health outcomes and uphold the rights and dignity of refugees worldwide.